Good afternoon, all. Am I audible?
Yes.
Yes.
Good afternoon, all. Welcome to National Association of Pharmacology and Therapeutics. I'm not feeling well for past 3 or 4 days, down with the dengue fever. Uh, we welcome you all on this platform of National Association of Pharmacology and Therapeutics. This is the 4th series of the competency-based medical education national workshop. And first, at the outset, I would like to convey my sincere gratitude to all the participants, all the delegates, for such an overwhelming response. We have started this series 4 years back. Dr. Badial and myself have put an idea of hosting the series of the competency-based medical education in specifically to the pharmacology. Now, CBME in pharmacology ensures that the healthcare professional possesses the necessary competencies to prescribe, administer, and monitor medication safely. This is crucial for preventing medication errors and adverse drug reactions, ultimately which is enhancing the patient safety. And pharmacologists can play very, very important role in this regard, in the patient safety. And CBME, competency-based medical education, is playing a very, very important role. Competency-based medical education guidelines have been revised by the National Medical Commission for the undergraduate level. We are all aware of it. And last year, the guidelines have been released in relation to the postgraduate pharmacology of MD pharmacology. So we are having the full picture of competency-based medical education. All medical institutions across the country have adopted competency-based medical education curriculum, and there have been many changes along with the challenges also. So with these words, I would like to invite our President, Madam Padamja Uday Kumar, to say a few words at the outset, at the beginning of the workshop. Dr. Padamja Uday Kumar.
Am I audible?
Yes.
Yes, madam.
Okay. So, dear members of the pharmacology family, namaskar and good afternoon. It gives me great pleasure to welcome all of you to this yet another feast, the online CBME series. This is again an academic feast. So as you have done earlier, the registrations have crossed our expectations, and thank you very much for your overwhelming response. We have a host of great speakers, and every speaker has been selected with utmost care to suit the topic they are talking. I have to place on record the dedication or work done by Dr. Kamal. As he has already told you, he is an inpatient now, and from his IP bed, he is coordinating all his activities. His dedication to NPT is something amazing, and thank you for that. We are really happy about it, and may you be well very soon. I thank all the speakers, the organizing team, and the moderators for their efforts for taking up this program. And most of all, I thank all the participants for showing their enthusiasm and their support. Thank you all. Jai Hind.
Thank you, madam. The guidance of our General Secretary, Dr. R.K. Dixit, time to time has been very useful in shaping up of National Association of Pharmacology and Therapeutics. He is with us right from the beginning, day one of the establishment of the organization. I would like to invite respected Dr. R.K. Dixit, our General Secretary, sir, to say few words on this occasion. Dr. R.K. Dixit, sir.
Good afternoon. Am I audible?
Yes, sir, you are audible.
Okay. So good afternoon. Namaste from Lucknow, Uttar Pradesh. So a very good afternoon, everyone. And first of all, I congratulate you all to choose. You have chosen a good, wonderful platform for learning session, and natural. And I am confident that all your learning will be in the positive reinforcement for the betterment of your teaching learning process of your individual as well as your in your institute. Two things I want to request you that we are having a association which needs two things. Any association needs two things. One is quality, another is quantity. So for the quality, we are dedicated, and everybody can witness the top quality of the activities through the forum of this association. Only request is that the quantity also matters. So for that, I request everybody, everyone who is involved in this workshop or is involved indirectly with other person to kindly enhance our strength by number, and that is by increasing the membership drive. And you all are a part of this association, and we all need your help to increase our strength, because I told you that we don't compromise over the quality, but naturally the quantity also matters. So for that, I request you all to enhance the membership drive by whatever you can do to motivate the MD Pharmacology person to join this association, which is exclusively only and only for MD Pharmacology. This is the only one platform where you have your identity, real identity. So with these words, I wish that this workshop will be a great success. And I thank Dr. Kamal and Dr. Padmaja Udayakumar and all of the associated members and other organizers for this wonderful workshop, which is being organized for the betterment. Thank you very much.
Thank you, Dixit, sir. Uduva, sir, can you allow me to share the screen?
Yes, sir, you can.
It is my privilege to introduce the moderators for today's session. The first moderator is Dr. Parveen Kumar Sharma. He is a professor and head department of pharmacology, SLBS, Government Medical College, Mandi, Narchok, Himachal Pradesh. He is controller of examination, Atal Medical Research University, Mandi, chairman of the Institutional Ethics Committee, CSI, IHBT, Palampur. He is coordinator of medical education. He is having a keen interest in the medical education. He is the author of the book of activity, book of medical pharmacology, which has been well taken by the pharmacology community. He has having credit of more than 20 research articles in national and international journals. The second moderator is Dr. K. Parimala. She is professor and head of the department, Meenakshi Medical College Hospital and Research Institute, Kanchipuram, Meenakshi Academy of Higher Education and Research. She is coordinator of AMC at the same institution, chairman of the Institutional Ethics Committee, former coordinator, present member at medical education. She is also having keen interest in the medical education related activities. She IQAC coordinator at the institution, chairman of Institutional Ethics Committee, Government General Headquarters Hospital, Kanchipuram, life member of the organization National Association Pharmacology and Therapeutics and IPS, alumni of CMC Vellore. Her area of interest is family medicine, medical education and technologies. Research thrust areas, cancer chemotherapy, induced peripheral neuropathy and neuropsychopharmacology. Published 30 papers in national and international journals. So with these words, I would like to hand over the session to the first moderator, Dr. P.K. Parveen Sharma sir, and first speaker.
Good evening, everybody. Good evening, everybody. We would invite, thank you very much for kind introduction. And we would start with our session. We would invite our speaker, Dr. Sawanand Pathak, who is professor and head department of pharmacology in JNMC, Swangi, Wardha, Maharashtra. Sir is a very senior faculty in medical education technology with a lot of interest. He is chairman of Institutional Ethics Committee, Regional Ayurvedic Research Institute, Government of India. He is former Director, School of Health Professions, Education and Research, DMIMS. He is former in charge of Central Research Laboratory, DMMS. He's got huge number of publications, total 58 publications and 8 books and 50 research papers. So sir is very senior person amongst our association. He has interests in preclinical research, medical education technology, and we are, sir, very privileged to have you amongst us and listen to you in this session.
Thank you, Sharma sir. I hope I am audible. Hello, am I audible?
You are audible, sir. You can share screen.
Yeah.
Yes, sir, you are audible.
Just share the screen, yeah. Is the screen visible, sir?
Yes, sir.
Thank you, Dr. Sharma sir, for that introduction. Let me begin with the name of God who gives us strength to endure. Respected teachers and my dear friends, A very good afternoon and hearty namaste to all of you. At the outset, let me thank the organizers of the workshop and National Association of Pharmacology and Therapeutics for giving me this unique opportunity of discussing this topic in front of such an august and intelligent gathering. Again, let me very humbly put the fact that it is just a very good luck and an association with some very good people like Dr. Kamal sir and his colleagues that today I am on the chair of the presenter. Otherwise, most of you are more intelligent, most of you are more experienced than I. So please feel free to stop me at any time to ask the question. Please feel free to stop me at any time to share from your vast experiences. And please feel free to stop me at any time if you think that I am going wrong somewhere to correct me. The topic of today's discussion is the assessment of communication skills in pharmacology. What are our specific learning objectives? That is, at the end of the session, we should be able to first define what exactly do we mean by communication. Second, define what exactly do we mean by skills. Define what is an assessment, because it is a communication skills that we want to assess. So we should know what these are. Followed by what are the competencies in pharmacology under competency-based medical education, CBME curriculum, associated with communication skills. And finally, what are the different feasible modes of assessment of communication skills in pharmacology, which we can utilize at our own setups. I will also share my experiences of what we are utilizing for assessing the communication skills at our place. So if we see, say, the communication skills, how we define it, it can be defined as communication is giving, receiving, or exchanging ideas, information, signals, or message through appropriate media, enabling individuals or the group to persuade, to seek information, to give information, or to express emotions. This broad definition includes body language, skill of speaking and writing. Let us try to understand. Now, I went through this particular definition as it is, but let us try to understand and keep in mind some keywords here. The keywords are exchanging or seeking the information. Definitely, whenever the doctor speaks with the patient, the doctor is seeking the information from the patient, exchanging the views, and also trying to express his own views. Those should go up to the patient as in the desired manner. But what is important here in the communication skills, it is not only speaking as we envisage here, it is also writing. Those are also the communication skills. Because when we write a prescription that speaks for a doctor in his or her absentia, not only that, whenever a student writes an answer sheet, the answer sheet speaks for the student in his absentia. It is the communication, the answer sheet is a communication between the student and the teacher in the absentia of the students, and the answer sheet speaks or communicates for the students. So that is another dimension of communication altogether that we receive here. Skill is the ability to do something well, especially after the training and practice. Definitely, what we call it as skill, whenever a person does something well, we call it as a skill. Otherwise, many sports persons, they know how to bat, but Sachin Tendulkar knows it very well. That's why we say that he is a skillful batsman. And how he has achieved it? Definitely by training and practice. Similarly, if we want to achieve the communication, not only communication, but communication skill, and we want that the communication skill should be imparted to our students, then training and practice is the most essential thing that is required. And not only training and practice, assessments in between so that the student can improve upon themselves. Now coming to what exactly do we mean by the assessment? What is an assessment? Let us try to see. Let us try to see the definition at verbatim, and then we will go to the keywords. Assessment is the systematic collection, review, and a use of information about educational programs undertaken for the purpose of improving student learning and development and make educational decisions if necessary. Definitely, what is assessment? We do collect the things, isn't it? Even if we collect the answer sheets, that is collection. It doesn't stop there. It leads to the review. It leads to review, giving of either marks or grades. What is the main purpose? The main purpose is for improving the students, improving the learning or improving the development. That is the main purpose. The secondary purpose is given later. It says making the educational decisions. Definitely, making the educational decisions are pass or fail. Whether the student is eligible to appear for the final examination or the summative examination. All these are there, or these are technicalities. But the main thing is we want our students to improve, and that's why the assessments, periodic assessments, do take place. As per the CBME document, suppose we say that these are the communications and communication skills, and we want to assess the communication skills. Where has this been discussed? Do we have specific things which are being provided in the CBME document? There are things. I will devote 2 slides for this. Since the time given is quite limited of about 20 minutes, I will not be able to go into very much details of each slides, but yes, we will definitely able to touch some of the things which are very important. So this is the things, this is the table which is most relevant table I thought of putting in front of everybody. That is, there are 3 competencies, PH 3.5, PH 5.1 and PH 5.4. PH 3.5 says to prepare and explain the list of P drugs in the given case or the conditions. So again, this is something which is a skill which is there. Second, we will see the next of the columns, we will see later. Communicate, PH 5.1 says communicate with the patients with empathy, very important word that is being used, ethics on the aspects of drug use. And what it is A/C, attitude and communication. That is the domain which is there. If we see PH 5.4, what it is, explain the patient the relationship between cost of the treatment, here the pharmacoeconomics comes, and again the patient compliance. Again, this is A/C, that is attitude and the communication. Again, level, it says the first one, it says P performs. Second one, it shows how. Again, this particular thing shows how. And very important thing, if you see core, all these are considered as the core competencies in the pharmacology. So if these are generalized, on these generalized competencies, we can develop ourselves well. So these are generalized, where it says these are all the core competencies which are there. Then it says skill station, small group discussion, but it also says regarding the suggested assessment method. The first one, it says the logbook. Second one, it says the skill station. The third one, it says short note or vivos. But there is quite a play that is being provided to us. We can go for different assessment methods depending on what is the feasibility which is there at our place. So this is there. These are the 3 competencies which I thought of putting in front. That is, in this way, there is a kind of attitude, there is a kind of communication, there is a kind of skills that are being involved. Now, this is the second table that I will like to put in front of you from perhaps the same document. That is in the phase 2, what it says, that is, these are the communication skills or skills required by the students. We will go one by one, and we will see where pharmacology is, because it speaks about the phase 2 as total awareness of professional roles and responsibilities of a physician, definitely. History taking clinical examination, it goes with the clinical side. Demonstrates the respect to the patient, privacy, confidentiality. All these are important whenever in the patient and the students or the doctors interact. Awareness of work ethics and medical legal aspects. It comes. The work ethics. It comes. The medical legal aspects when it comes to practicing the pharmacology or prescription of the drug. Taking informed consent. Definitely it comes. That is whenever we go for the clinical trials, taking the informed consent. Not only that, nowadays the ICs are recommending for the recorded informed consent, video recording of informed consent, so that informed consent. Next is proper prescription writing. Can you see here? That is being added in the communication. In fact, it says writing. It is not only writing, but also explaining the patients regarding what the prescription is. So even that writing word, we get the information of why this writing is there. If we see the definition of the communication, it says even the writing, whatever we write is the mode of communication. Addressing the patient queries. Will not the patient query to you when the patient will read the prescription about the procedures, diagnostic and therapeutic options to the patient? Not only to the patients, very important thing is family members also, we should be able to explain, checking, understanding, and given instructions, and allowing the patients to participate in the decision making. It is not something, an authoritative thing which is there. Participation in the decision making is quite important. And where it can be learned, that is also being given. It can be imparted, it can be learned at various places, like clinical postings and OPD. Pharmacologists don't have much of a say on this. Community visits, that is the domain of the community medicine, preventive and social medicine people. Lectures, yes, we do. And the last one is very important, that is the communication skill laboratories. Yes, last two domains which are there, communication skill laboratories and the lectures, we can make the most of it while we are assessing or while we are imparting, I will say, the skills. Now, how the skills can be imparted? It again says role plays, videos, sessions of prescription writing, observing the clinicians, then practice sessions using real and simulated patients. I will like you to just concentrate on this particular word, that is simulation, and writing of the reflections. We will see what the reflections, but this is how it should be imparted. Today's topic is not about how we impart this, because that is a separate topic altogether. We will require a lot of time. But our topic today is the last column, which is there, how it is to be assessed. It says OSCE. It says feedback from the trained simulated patients. Again, I will like you to just concentrate on this particular word, simulations. And then mini CEX, it says, and grading and feedback on the reflections. So if we see today's topic, that today's topic is given in the last of the column, where we can discuss over that is OSCE, feedback from the trained and simulated patients, mini CEX, grading and feedback on the reflections. Let us see one by one, because in itself, it's a big topic. Suppose I say OSCE, a kind of full presentation can be given on OSCE, but we will just see that what it is. We'll see a kind of advantage and disadvantage. We'll move to the next, and then I will also narrate my own experience. That is how we are conducting it here at our place. So this is OSCE and this. We will go to the next slide. That is the OSCE, objectively structured clinical examination. So prescription writing, prescription giving or explaining, all this is the clinical thing altogether. So with the patients observed directly by the assessors. Now generally I'm speaking, that is the patients, real patients are kept there, and then the student is asked to demonstrate or to communicate in the required thing that is being asked from the student. And we know there is something like this. There is a checklist, something like this, as you can see here. Then what is the maximum? There are steps which are there, maximum marks, and then the actual marks which are there. And then marks, it says in this particular checklist, it says maximum of 10 marks, and out of 10, how many marks are being obtained. And then these marks can be converted into grades. That is something again, different topics. How do we convert the marks into grades? But this is how the things are. This is how the OSCE is. This is how the OSCE stations is. OSCE stations, we are more familiar. OSCE stations are also there. But we tried to implement it. But there were some advantage and disadvantage. Number of things are there, but we pursued major 2 or 3. What was the object? What was the advantage? It was really objective. And it was what? A realistic thing which was there. But disadvantage was assessment during the examination is one of the most disadvantaged things here, because one person has to continuously stand there, continuously assessing the things. And many a times it is not possible. And then we will have to change the assessors. And when the assessors are changed, again, there is a subjective type of the change that is being there, difference which is there. So that is asked. Then there is something called as mini CEX. CEX stands for the mini clinical examination, which is there. What it is? If you see the clinical examination as a whole, history taking examination, and finally coming to the diagnosis, explaining the patient, the treatment modalities, explaining the patient regarding the prescriptions, regarding the questions of the. So it is something, mini CX is something where we are taking a snapshot of whatever we want. As a pharmacologist, I want the last part of it, which takes around 10 to 20 minutes with direct observation, assessment. And the word used here is a very beautiful word, that is a snapshot. Their encounter can be of half an hour, but my snapshot is last 10 to 20 minutes, where the person is explaining regarding the pharmacological aspects of the drugs, of the trainee-patient interaction. What is the advantage? Mini CX is always conducted at the clinical setting. That this is the fundamental. We cannot conduct the mini CX which is there at our department. It should be at that particular place. But what is the disadvantage for pharmacologists? Generally, the access for the pharmacology towards the clinical side is quite difficult to get. Even if you get the access, then I will say the ego clashes, they come. So that is how the things are there. So this one disadvantage keeps us away from going to mini CX. Now, this particular thing, that is assessment using standardized patients, that we have experienced a lot. Because we have the standardized patients program, SPP program, at our university, DMIHER, the Tamagi Institute of Higher Education and Research. And this particular program is infused by Mayo Clinic. Mayo Clinic USA is the clinic which is a very famous one for the simulations as well as the standardized patients. It is being a very famous type of a clinic, very famous type of organization throughout the world. We have direct contacts with them, and according to their advice, according to our discussions, we try to develop this. Now, suppose I want to assess, and the assessment and training goes simultaneously here, as you can see. For both we can. Suppose I want to assess how the student communicate with the patients with empathy and ethics on all the aspects of drug use. So what is being done? First, we come together. This is the real thing that I'm showing. First is we come together and we discuss regarding this, how an SP can be developed here. SP is the standardized patients we are utilizing for this. These are the normal patients which will enact. So how many normal patients we will require, what inaction is there, should be there, and what type of scripts that we prepare here. Then we go for the simulation wards. We have a simulation ward. This is the entry of our simulation ward, which is infused by Mayo, and it's a simulation. Can you see here? There are beds. At present, we have 8 beds with us, and this is the whole simulation ward. It looks like a ward, and it has the curtains, and so there is isolation that can be there. As you can see here, there is a station from which we sit, and we can see how the interactions are going on between the student and the patient or simulated patient. Here we can see the video also of that. 7-8 windows will come, and then we can assess here. We can even listen to whatever cubicles we want, what is happening. Now here, that is how it goes. This is the cycle. I'm not going into very much detail due to the constraint of the time. First is there is a pre-briefing. You can see here that the batch has come together. We brief the batch that what is the expecting today when they will be going to this simulation wards. Then we tell them that such and such scenario is there. You have to give a bit of examination. We will not much give them the examination since we are pharmacological point of view. Pharmacological point of view, that is, you have to prescribe them the drug. You have to explain them the drug. You have to answer their queries regarding the drug. Accordingly, you have to write an ideal prescription for this patient. Not only write, you have to explain this. As you can see, the students here, this is just recent ones that I have taken. And then there is a debriefing. Debriefing means after the encounter is over, each encounter is about 8 to 10 minutes. And when this encounter is over, as a batch, we tell them that what has gone wrong. What should be the thing which should be the most idealistic thing. And this we do by assessing the things. Now, the beautiful thing here is that the assessment is not only by the doctor, but it is by the standardized patient. The standardized patient is told how you will be assessing. As you can see the proforma here in a vernacular language, that is Marathi, and then they will tick regarding these aspects of the sensitivity of the doctor, the punctuality of the doctor, whether there are etiquettes of the doctor, all these things. Then the prescription that comes, that we will monitor. The rest of the things we will analyze, and then the kind of assessment can be done here. As you can see here, the assessment is being done by the assessor sitting behind the glass, where we can see them, but they will not be able to. And then we are assessing them on this particular assessment sheet, which is there. Now, what type of things are there? There is something called as doorway information. Before the person goes inside, then there is a doorway information which the person will read. They will be given what is the BP, temperature, heart rate, and all these things, and what the now here there is just a patient of chest pain, or in the case of angina, the patient will enact like that. And with this information, the person will go inside, do a kind of physical examination, and then will give the prescription for the patient. Can you see here? These are the things which are there, which the standardized patients will tick. Roll numbers are there here, and they will tick. Like doctor ka vesh yogya hota ka. This is in Marathi. Whether the doctor was dressed properly, whether when before coming, whether the person asked for the permission, whether the doctor introduced himself, whether doctor asked you your name, and then doctor used that name in the communication. Just by saying that my patient's name is Mohan, that doesn't mean. But you have to use it in the conversation. Mohanji, it is like this. Mohanji, it is like that. So whether this is being used, whether the doctor has given you the information, whether the confidentiality is being promised or not, whether doctor thanked you, or lastly, if you are a female, then whether the doctor kept another female while explaining all this to you. Though the things go in 10-15 pages, due to the paucity of the time, I am just putting in front of you two of the things which are there, which can be utilized here. So these are some of the formats which are. What is the advantage? We are running this since last about 1 year or so. So what is the advantage? It's feasible. At least at our setup, it's feasible. Secondly, comfortable for large group of students. At one go, there will be 10 students who will be analyzed in, say, 5 to 10 minutes, which are there. Comfortable for large group. Assessment by simulated patients themselves. Patients are themselves assessing the things. They are trained for that. Encounter about 7 to 10 minutes. Can prepare the students for higher examinations like USMLE and PLAB, where the standardized patients are used for assessment. They use standardized patients. Disadvantage, requires simulation ward. A setup is required, definitely. Though it may not be a very much high profile setup, a kind of small setup is required, a room is required where at least 6-7 beds are being kept, maybe 10 beds. But second thing is important, simulation patients, they will not come free of charge. They have to be trained and paid for the session. We are utilizing the retired staff of our own institute for this particular purpose. They are paid as per hours and whenever they come for the training. And they can be trained in number of scenarios which are there, single person, and then the training will not be required again and again. So these are the things where we have, though it's a disadvantage, wherever it is feasible, one can definitely be utilize these particular things in the in practice. Lastly, grading and feedback on reflections. Reflection is something which is not very structured. Just I see the patient, just I see the interaction, I reflect on that this was not good, probably this should have been done, this did not go well, and that did not go well. So there is the Hotman and Smith, they have given what type of reflection? Descriptive. Overall, it is a descriptive only. Or dialogic, that is, I wonder if this could have happened, perhaps this should have been done. And there is a critical reflection, that is context where the event occurs, with this, whether it is true to this this particular event at this particular context or not. Now, what is the advantage? We get a critical analysis, definitely. It's a very good thing for critical analysis. In day-to-day life also we do it. But what is the disadvantage? Difficult to convert to marks and grades. When it comes to giving the marks and grades, it's very difficult altogether. So this is grading and feedback. So out of all this, using of the standardized patients, we thought is quite a good thing which is there, which we are utilizing for assessing. As per the feasibility, the things can be utilized. Marks can be given, converted into grades. There is a separate session from marks to grades, so I will not go into details of that. The things can be included in formative assessment as well as the summative assessment also. So we started with following specific learning objectives. Let us see whether we are clear on that. First was define what is communication. Have we defined? Yes, we have defined. We have said it is not only words but also written. Define what is skill. We said that it is a practice that is required with communication with the assessment. Define what is assessment. We said what defined what exactly we mean by assessment. It is for the improvement, for giving the grades, marks for the purpose of passing or failing also. What are the competencies in pharmacology? At least we have seen 3 competencies which are there in the pharmacology, in our curriculum, in our CBME curriculum, which requires this communication skills. Feasible modes, we have seen OSCE, we have seen mini CX, we have seen simulated patients, and then we have seen reflections. Even the logs books can be utilized for the feasible mode of the assessment. So this is all from my side. Thank you very much for your patient listening. Here is my mail address and here is my number, the mobile number. You can contact me at any time if you want for expressing your interest or for discussing it further. Over to Dr. Parveen Kumar sir for further proceeding. Parveen sir, please.
Sir, thank you very much. This was really a beautiful presentation. I hope and I know that everybody is benefited. You have very nicely explained what is communication, what are skills, and what is assessment. And in assessment, you have described what is OSPE, what is mini CX. And what I see is people are more interested in what you have explained, that is standardized patient. Yeah. People are more interested in that. And we have received some queries also, like how to train in this. I think if Dr. Kamal sir permits, can we take 2-3 minutes?
Yeah, sir, we can take some questions.
Thank you, sir.
Then rest of the questions can be discussed in the group. We can take 2 or 3 questions.
Just, sir, people are like, we have received some queries that how you train these standardized patients. And in assessment, there is one query that how do you include it as an part of overall assessment? So these are 2 questions I would request you to please.
Thank you, sir. I will come to the first question first, that is how you train the standardized patients. First, what we have done, let me just explain it. We take our retired persons from our college because they are free. Otherwise, if the person is working in the college, it becomes very difficult to call them and again from their duties. So retired persons. Secondly, what we do is first we should have the script ready as to what the doctor has to say, what the patient will say. If the doctor asks something, what the patient will. The script will go for 2 or 3 pages. The script will be. Then we will call the best of the actors amongst them. So the person will come. We will give him the script and he will by heart the script, enact with that, and we will have one student there, and the student will ask the question, he will answer. That should, and the student has to behave and ask the questions and behave in idealistic manner. We will get the video shooting of that. Once we have this video shooting, the next step comes. Next 8 of, because 1 we have trained, now 7 is there because we have 8 beds. Now the 7 of the SPs or standardized patients, we will send them this video. They have a group, WhatsApp group. We will send them this video. We will send them the script. Now we will give them 7 days to enact this at their home. They will practice this at their home. Then we will call them after 7 days, and we have a form. We will analyze them whether they have really have done their homework well and whether they are suited to be SP for this scenario. If they are, then we certify them that yes, you are suited for that. Now what we will do, we will incorporate. Now coming to this particular thing, how the overall assessment, we have incorporated this in their timetable itself. Like for us, we are taking it for each Thursday from 9 to 12. This particular role for a particular batch. We have a batch of around 7 to 70 students or so. So for that, we are conducting this particular. So the SPs will come 2 hours prior. They will be given the proper dress. They will be there on the bed. And then in the batches of 8, the students will come, practice for 10 minutes, and they will go. They will be pre-briefed. Then there will be this session. And then there will be the post briefing that will be there. Ideally speaking, each and every student should be debriefed. That is what SP says. But it is not possible in the Indian scenario to do that. Neither we have that much of time which we have. So we give the pre-briefing and debriefing in group. So that is there. As far as the overall how you incorporate this, the incorporation of this in both formative and summative examination can be there. Now see, and this happens very quickly. It doesn't require much of a time which is there. So if there is a batch of like 30 or 40, then within like say 40 minutes or so, we can do. We have assessment. Assessment is done by the SP itself. We have the written prescription. Otherwise, we have to check the written prescription. Even in the absence of SPs, we check the written prescription which is there. And thirdly, we can ourselves also assess the whole things which is there. One of our colleagues will assess the whole thing. So we have incorporated this in a way, and even in the curriculum, being from a deemed university, we have a bit of play that is being given of changing a bit of curriculum, not very much. They say 2 to 5%. That we have done, and we have incorporated this here. I hope this solves the query of the both the queries.
Sir, thank you very much. You very nicely explained the queries also, and we have some other queries also. Actually, like you said, you can slightly change also, but I think NMC also has provided the provision for. We do have already long exercises, short exercises in exams. So one of them can be communication skills. So I would hand over back to Dr. Kamal for next session, please, sir.
Thank you, sir. Thank you very much.
Thank you very much, sir.
I would like to hand over it to the next moderator, Dr. Parimala. Dr. K. Parimala.
Yes, sir. Yes, sir. I'm audible. Am I audible?
Yes, yes.
Yes, sir. Very good afternoon to the very good afternoon to the August audience, sir, who have joined the online CBME online series in pharmacology, which is the 4th series, sir. I would like to introduce, sir, the speaker for this session, Dr. Suyog Sindhu, who is MD Pharmacology, a FIMA Fellow, who is a faculty member and resource person at MET NMC Nodal Center, King George Medical University.
Madam, you are muted. Your voice is not audible.
Yes, sir. Madam has authored 3 books, sir, for a credential, sir. One which is released in 2021, which in CBME Pharmacology Skills in OSPI Practical DOAP, and one in 2019, where it is History of Medicine, an enthralling saga of man's struggle against disease. And the third one in 2014 for undergraduates, which is a learning practical pharmacology. She is a member of editorial board, National Journal of Pharmacology and Therapeutics, and she is involved as a resource faculty in various national workshops and conferences, and also been a part of organizing team for various national conferences. She has been the member of National Association of Pharmacology and Therapeutics, and also a member of Association for Medical Education in Europe, Dundee, UK. Madam, now I invite you to start the session on assessment of reasoning skills in pharmacology. All the best.
A very warm namaskar to esteemed all. Thank you, Dr. Parimala ma'am, for that nice introduction. And like Sawanand sir said, just by chance, sheer chance that I am sitting on presenter chair today, and there are many learned and scholarly people sitting on the other end. So kindly check me whenever required. So not taking much time. Moving ahead, I'll share my screen right away. So is my screen visible? I put it in the slide mode show now.
Yes, it's visible.
Okay, so I'll start the session. So the topic allotted to me is assessment of reasoning skills in pharmacology. And the learning outcome is, at the end of this session, participants shall be able to frame questions to assess reasoning skills in pharmacology. As this topic is very less heard of, so actually I didn't know what to talk about in the session. But going through literature now, I have somehow framed something for this session. So let's see if I fulfill this outcome. So before I start, like previous session by Sawanand sir was very comprehensive yet enlightening. So in this session, I will like to have sort of interaction with the delegates. We'll have it on the chat. So what I have planned is I'll start with the little warm-up. I'll throw 2 general questions. Okay, they'll be reasoning based general questions. And the participants can put their answer on the chat box. And I request Dr. Parimala ma'am to just take the name of the person who answers, who gives a correct answer at the first go. Okay, so let's start with it. So the first question comes up here. It's a simple reasoning question. Here it goes. 3 statements are given. Statement 1 says Tanya is older than Rohan. Statement 2 says Chandan is older than Tanya. Statement 3 is Rohan is older than Chandan. So if the first 2 statements are true, so what do you think about the third statement? It is true, false, or it is uncertain? So ma'am, please let me know if you get the right answer. As soon as you get the right answer, I'll display the right answer on the screen. Have you got the correct answer, ma'am?
Yes, ma'am.
Okay, so the answer is false, because as per the first two statements, Rohan should be the youngest one. So that was the first question. Let's take up the second question. Once again, we have got 3 statements. Which statement 1 is Jessica has 4 children. Statement 2 of the children have blue eyes and 2 of the children have brown eyes. Statement 3 says half of the children are girls. Now, if the first 3 statements, all these 3 statements are facts, they are true. Which of the following statements must also be a fact? Like first statement is at least 1 girl has blue eyes. Is it true or not? Statement 2, 2 of the children are boys. Statement 3, the boys have brown eyes. So out of these, like option A says only first statement is true. Option B says second statement only. Option C, the second and third only. And D says none of the above statement is a known fact. So, ma'am, please let me know as soon as you get the correct answer.
Most of them have given us B, madam.
Okay, so the answer goes is correct answer. So now, so this was just an example. This is a very easy question just to warm you up. So like you must have felt while taking up this question, there's something like your mind has started working. So this is how we want the students to work in pharmacology as well. So first, let's see what NMC has to say. Like in the month of August, we all got this document from NMC, which has given goals for the learner, IIMG, which read as like this. Earlier, we had 5 goals, like clinician, leader, communicator, lifelong learner, and professional. But now NMC has added 2 more goals. That is, our IMG should be a critical thinker and also a researcher. So going with the critical thinker aspect. So we have to make our IMG a critical thinker. Okay. So critical thinking is a wide aspect. So it says that critical thinking is the process of analyzing and evaluating information to form a judgment or decision. So it is comprising of three things. A person analyzes the things, evaluates it, and then takes decision. So these three aspects are present in critical thinking. The middle one, that is the evaluating information. This aspect, that is evaluation of the information, whatever information we have, and based on the knowledge that we have imbibed till now. So we have to judge whether that information is correct or not. This is the reasoning aspect. This is what we have to train our students in. Before they take the decision, they should be able to think logically and make inferences based on the evidences or facts. So this is reasoning. Reasoning is a part of critical thinking. So then the next question, why are these skills required in pharmacology? The basic question for this session. So these reasoning skills are required as they contribute to safe and effective medication management, research, and also in decision making. Decision making regarding like choosing the most appropriate drug amidst the whole plethora of drugs that are present with us in today's state. Secondly, for assessing the drug interactions, because we are into the polypharmacy, we are prescribing polypharmacy now and then. So one should be aware of the drug interactions. Then dosing and treatment planning. So based on the facts, student has to reason out which dose, in what dose the drug should be prescribed and make the treatment plan. The student should be able to evaluate the adverse events based on reasoning skills. Then reasoning skills are very much required in the research. If a student has taken up some research, then you should be able to reason out how and why the drug is acting and how it is being affected by other drugs or other parameters. So everywhere reasoning is required. Regarding patient education, there too, a student should be able to reason out. If like say if certain patient is in a habit of skipping drugs, is missing doses, then how to counsel him? He should be counseled, his attendant should be counseled that he should be adhering to a fixed timetable of taking the medication. Or if let's say a patient is he's in the habit of missing drugs, then the student should be able to choose a drug which has got longer T-half so that his missing habit could be covered up. So this way a student has to should be able to reason out for the patient education. Then regarding medication safety, of course, and the reasoning is required. And then evidence-based practice. So how the pharmacokinetics or pharmacodynamics are being affected of a drug, maybe how the pharmacogenomics or genetics is affecting the action of a drug. So all that has to be reasoned out. So for all this thing, to make a decision, the student requires reasoning skills. And so this session is here. Now the next $1 million question is how to assess this skill. There is a lot of literature available that we have to train our students in critical thinking. They should have reasoning skills. But then the question is how to assess them. And I went through the literature, but nowhere did I find anything on assessment, how to assess the students for their skills. So ever since this document came out 2 months back, we have framed up some questions for our students. And I'll just show you the questions which we are using for our students, and that might give an insight how you can frame your own. So going on the same way, I'll display the question on the screen and you can put the answers in the chat box. So that will be a sort of interaction and a sort of workshop online. Okay. So here goes the first question. And I once again request Parimala ma'am to just be alert on the chat box. And please let me know whenever the first correct answer comes up.
Surely, ma'am.
So here we go. So this is a scenario-based question. So like you will have an idea by these questions how we can frame the reasoning-based question. So first one is a scenario which says a patient with a history of peptic ulcer disease is prescribed a non-steroidal anti-inflammatory drug for the management of chronic pain. The patient experiences gastrointestinal discomfort. Okay. The question is, what should the healthcare provider recommend to minimize gastrointestinal discomfort in this patient while maintaining pain control? So option 1, A says continue the NSAID at the current dosage. B says discontinue the NSAID and recommend alternative pain management option. Option C says lower the dosage of the NSAID. And the last one is add another NSAID for enhanced pain relief. So what do you say? Did we get the first correct answer?
B.
Yeah, got the answer? So
B.
the answer is B. Yeah, that's right. That's right. So this is a simple question. And by this question, like we are assessing the reasoning skill in dosing, treatment planning, and also medication safety. So if the student is able to answer this question, that means we have assessed his skill regarding dosing, treatment planning, and medication safety. Next question comes up like this. Again, a scenario-based question. A patient taking a combination of drugs, including an anticoagulant, reports persistent bruising and bleeding from minor injuries. The question is, which drug interaction should be considered as a probable cause of the patient's bleeding symptoms? Option A, interaction between the anticoagulant and a blood pressure medication, interaction between the anticoagulant and an antibiotic, interaction between the anticoagulant and a dietary supplement, interaction between the anticoagulant and a pain reliever. So most probable one, which could be the option? Ma'am, did we get the answer?
Yes, most of them have answered D, madam.
Yeah, it's perfectly all right. So these are simple questions once again. And through this, you can make out that we are assessing the reasoning skill regarding drug interaction. Now, once again, a scenario-based question. A patient with a severe respiratory infection is prescribed 2 antibiotics simultaneously. On first day of treatment itself, the patient's condition worsens and he develops difficulty in breathing. Okay, on the very first day, he develops that problem. The question is, what should the healthcare provider consider as the primary reason for the worsening respiratory symptoms? Option A, non-compliance with the antibiotic regimen. Option B, progression of the respiratory infection. Option C, potential drug interaction between the 2 antibiotics. Option D, allergic reaction to one of the antibiotics.
Most of them have answered D, madam.
Okay, so that is allergic reaction. Very well said, because it has happened immediately.
Correct.
So first thing that should come in mind is allergic reaction. So here we are evaluating the reasoning skills in adverse event evaluation. Okay. So the set of questions that I'm presenting right now is mixed for UG students, also for PG students. For both set of students, we can use such type of questions. They are simple ones, but yes, they can assess the reasoning skill of the students. Now, this is fact-based question. So like fact 1 says, a drug W is known to interact with grapefruit juice and can lead to increased drug concentrations in the bloodstream. Okay. Fact 2 says the patient regularly consumes grapefruit juice. So the question is, what instructions would you give to the patient while prescribing drug W, considering it to be the only first-line drug for patient's medical condition? So you need to write the answer. This is open-ended question. Okay. You got the answer, ma'am?
Yes.
Okay.
Not to consume grapefruit juice.
Okay. What if the patient says that I'm in a habit of taking it?
So they have given.
So that's true. That's true. He can
avoid.
consume, but then we have to tell him that this is regarding patient counseling. How will you counsel? You can't straight away ask him to not to take grapefruit juice. Maybe for the few days that he's been prescribed, that for those days he can stop taking. Or even if he keeps on taking, then and he has some symptom, the symptoms can be told to him, then to immediately tell the physician or tell his attendants, he should himself get regularly monitored. So these are the few points which should be told to the patient. So this is the aspect of patient education. So any of these, if the student is answering,
Yes.
These points should be covered somewhere or the other, then we can say that the student is able to reason out. Next question is again a fact-based and an open-ended question. Fact 1 is drug C is a potent inhibitor of cytochrome P450 enzyme. Fact 2 is the patient is taking drug B, which is primarily metabolized by cytochrome P450. The question is, if you have to prescribe both the drugs together, C and B, both the drugs together, what modification need to be made in the dose of drug B? So did we get the answer, ma'am?
Yes, madam. Drug B, dose to be reduced.
Oh, that's
Yes.
great. So,
Thank you very
so this way we are checking once again the reasoning skills in drug interactions, dosing, treatment plan, and medication safety. So these aspects would be checked through questions of this type. Next is again a fact-based question, an open-ended one. Fact 1 is drug E is a prodrug that requires metabolic activation in the liver to become pharmacologically active. Fact 2 is the patient has severe liver impairment. So the question is comment on the therapeutic effect of drug E due to the liver impairment.
Low. The answer is
What
drug
the answer?
toxicity. Drug toxicity. Drug E.
Yeah. So what? So what they had to give the answer drug E about that.
Yes.
Like
Reduce
it's
the
not
dose
able
of-
to.
They given
So
reduce the dose of
thera-
drug E.
Okay, dose what? Dose should be what? I'm asking about therapeutic effect of drug E.
So few have reported depends on the metabolic fate.
But that like I have given now, the drug E is a prodrug which needs to be activated. And like it stays liver impairment, so it will not be activated. So definitely we can predict that it should be having lesser therapeutic effect. That's what we can say by these facts. I forgot one more thing, ma'am. Initially I said that we will be announcing the person who gives a correct answer, the first one to give the correct answer. So we missed all those names till now. So from now we can continue with that.
Yes.
So can we have the person who answered this question correctly?
Many of them have answered, ma'am.
The first one.
Druggy, Dr. Bhuneshwaran.
Okay, so that's
Effect.
it.
Yes.
Dr. Bhuneshwaran, so congratulations. Let's move to the next question. If there's any doubt, we can take up the doubts later on for any of the questions. We can discuss. Or if you want, we can discuss right now also. If anyone has some query, please raise your hand. Okay. Ma'am, is there any query? Or can you move ahead?
No queries.
Okay, sure. So next one is again a statement-based open-ended question. Statement 1 says drug Z has a high protein binding affinity. Statement 2 is the patient has hypoalbuminemia. The question is how might hypoalbuminemia affect the pharmacokinetics of drug Z? Basic questions. Ma'am, have you got the answer?
MISA has given toxicity.
Okay.
Uh,
Fine.
More
It
free
can be
drug in
toxic.
plasma. More free drug in plasma.
Yes.
Most of
It
them
may or may not be toxic, but definitely yes, the higher plasma level.
increased plasma concentration of drug. Dr. Nandini and Dr. Nidhi Maheshwari have answered.
That's great. Congratulations. So here we are checking the reasoning skills in dosing, treatment planning, and medication safety. Then statement 1 for the next question is, drug Y is a substrate for P-glycoprotein efflux transporter. Statement 2 is the patient is taking a P-glycoprotein inhibitor medication. And the question is, what effect may the P-glycoprotein inhibitor have on the pharmacokinetics of drug Y? Okay, did you get the answer, ma'am?
Reduced bioavailability. Answered by Lyromi.
Just think over once again.
Yes, reduced
the answer also.
bioavailability. Answered by
Like,
Lal Ramovi. A few have answered toxicity may occur.
yes, so like according to me, P efflux transporter will be transporting the drug out of the blood compartment. Okay, and the P glycoprotein is inhibited. So what do you think? the plasma concentration should increase or decrease?
Increase.
It should increase. So the first person who had answered that the
Increase the
reduced
plasma.
effect.
Manish Solanki. Manish
So
Solanki.
Manish, so Dr. Manish is saying rightly, what I agree is that should be increased viability, not decrease. Somebody had answered that it should be decreased viability. So if any controversies are there, we can discuss. Somebody wants to say something.
No, ma'am.
Okay. So here again, we are talking about drug interactions. So next question is statement based. Statement 1 is drug G has a long duration of action. Statement 2 says drug H has short duration of action. Statement 3 is the patient has difficulty in adhering to a frequent dosing schedule. The question is, which of the two drugs can be considered for the above patient? That is G or H. Which of these?
Yes, drug G, G, Dr. Nidhi Mageshwaran has answered, madam.
Okay, once again, I think
Once again,
he
is
had
answered.
answered it.
Yeah.
That's great. Congratulations. So the simple one. So here once again, reasoning skills in dosing and treatment planning are being checked. Fact-based question, MCQ 1. First one is drug C is a competitive antagonist at a specific receptor. Okay. Fact 2, the patient is taking drug D, which is full agonist for the same receptor. Fact 3 is the patient experiences reduced therapeutic effects when drug C is administered before drug D. Okay. What can be inferred from the sequence of administration and the observed effects? Option A says drug C has a longer duration of action than drug D. B option says drug C is an irreversible antagonist. Drug C says drug D has a high affinity for the receptor. Option D is drug D is a partial agonist. Which of these? Based on the above facts.
Most of them have answered C. Dr. Parveen R. Parveen R has answered first.
C.
C.
First. Okay, that's great. I'll also go with that, the same answer. So drug D has a high affinity for the receptor. That's why it was able to remove the antagonist, the competitive antagonist. This is a simple basic knowledge that we are checking. And this knowledge will be checked. The reasoning skills will be used during research. So like when somebody is researching on particular drug, so how its effect is being, how it is being affected, how the pharmacodynamic is being affected. So if some inference is to be taken out, then this reasoning skill will help me. Next question is again a fact-based question. Fact 1 says drug G has a narrow therapeutic index. Fact 2 says the patient has a history of non-adherence to medication regimens. Fact 3 is the patient is prescribed drug G. The question is, what concern should be emphasized when prescribing drug G to the patient? Simple one, open-ended, regarding patient education. Did we get the answer, ma'am?
Yet to get, ma'am. Yet to get. Yeah. Monitoring. Dr. Shivangi. Shivangi is, yeah.
Okay. Okay, we have to monitor it.
Monitor.
And we should ask we have to monitor, but like I asked, what concern should be emphasized in prescribing the drug to the patient? Okay, ask him to get it monitored and also ask him to adhere to the dosing schedule. And okay, that's it. Both answers are taken. That's very nice. So we are talking about patient education. So reasoning skills required for patient education. Explain why the combination of an ACE inhibitor and an angiotensin receptor blocker is generally not recommended. Open-ended question.
Yes, ma'am.
Did we get the answer, ma'am? Yes.
Hyperkalemia, Dr. Mrinalini has answered correctly.
Congratulations, Dr. Mrinalini. That's rightly said. And we have checked the reasoning skills in drug interactions and medication safety. Move on to next one. A fact-based question. Fact 1 says drug F, which is used for managing a psychiatric illness, has a narrow therapeutic index. Fact 2 is the attendance of a patient complained of his aggravated symptoms for last few days. That is, earlier the patient was relieved by the drug, but now for the past few days he's having aggravated symptoms. The drug is not affecting. The question is, what aspect of the drug or dosage would you be concerned at the very first instant? open-ended question.
We have received therapeutic drug monitoring as answers, and few have
Okay.
answered non-adherence. And
Yeah.
few have
So the
also answered as compliance.
compliance. Okay.
Compliance.
So non-adherence, compliance, the same thing.
Same
So I also go with the same answer.
Yes.
So first of all, we have to check whether the patient is actually taking the medication or not, because till now he was relieved, but suddenly he's not having the effect. So what is the matter? And he's a psychiatric patient, so it's very much probable that he might have missed some doses. So that
Dr.
should be the
Parveen
first thing.
R.
And
As
Dr.
answered.
Parveen R.
Yeah.
It's answering so well. Congratulations, sir. So many answers you have answered. First person to answer the correct one. So through this question, we are checking the patient education, reasoning skills in patient education. And coming to next, this is an MCQ-based question. In a pharmacokinetic study, if we plot a concentration time curve, what would the area under the curve represent? A option, the rate of drug absorption. B option, the drug's half-life. Option C, the total exposure of the drug over time. Option D, the maximum plasma concentration, that is Cmax of the drug.
Most of them have given the answer C, madam. And Dr. Parveen has again answered fastly.
That's great, Dr. Parveen. So I
Fastest
agree with
finger.
that. Yeah. And so this reasoning skill will help the student during the research work. So when he is plotting the graph, what the concentration of the drug, so how much drug is accumulated over a time. So that would help him. Next, in a clinical trial evaluating the efficacy of a new drug, okay, what would be the dependent variable? Option A is dosage of the drug. Option B, age of the participants. Option C, blood pressure of the participants. Option D, outcome or response to the drug.
Most of them have answered A, but Deepti has answered correctly, madam.
Deepti.
Yeah, option D.
Option D. Also go with the option D.
So,
So talking about the outcome, dependent variables. So like we are evaluating the efficacy of a new drug. So that's why I thought that if we are evaluating efficacy, that means we need to see the outcome. So I have taken the answer D. I agree with that. If anyone has some queries, you can raise your hand if you disagree with the answer. And of course, this reasoning skill will help during the research. So like you can see how we have elevated the quality of questions. Starting from the basic ones, now we have come to the postgraduate level questions. So this is how you can frame your own set of questions. Okay, the basic things, but then frame such a way that we are checking the reasoning skills. Next one is scenario based. You were studying the pharmacodynamics of a novel anti-cancer drug. In vitro experiments showed that the drug has a potent inhibitory effect on a specific oncogenic pathway. Okay, so this is by preclinical studies you have done. Now, however, clinical trials demonstrate variable response among patients. The question is, which of the following is not a potential strategy to optimize patient outcomes? That is what you will not do. That's you want to have a effect in the patient. So for that, what all will you do? And the question is what you will not do. Yeah, that in other words, which will not increase or which will not maintain, which will not be effective in maintaining an optimum effect in the patient. So the option A says pharmacogenetic testing. Option B, individualized dosing. Option C, patient education. Option D, toxicity study.
most of them have answered C, madam, but Nidhi Mageshwaran has answered correctly. Option D.
Okay, so let me explain it. Like I also go with the option D. Why? Because like we have studied a drug and preclinical studies show that it is effective. Okay, but when the clinical studies are done, variations are seen. So if we have to use this anti-cancer drug, suppose it is having very nice effect, but it is having variable effect in the patients, then how to ensure that a particular patient will have the effect of this drug or not? So of course, we'll do pharmacogenetic studies and accordingly we can manage the dose. Secondly, definitely the same thing, individualized dosing based on the pharmacogenetic studies. Third one, patient education as well. If a patient, maybe in some patient with the pharmacokinetic studies show that it has got longer T-half, then we can give less dose. And if in patients having shorter T half, we can increase the dosing. We can decrease the dosing duration, or number of dose can be increased. So that way, this all will help. But how will the toxicity study help in this? Okay, we want to have the effect of the medication in the patient. So how at all will the toxicity study help in that? So that was how I reasoned out that toxicity study will not be helpful to optimize the patient outcome for this particular drug. So if still any queries, please.
5 more minutes, ma'am.
Sure, ma'am. I think it's the last.
Sorry to disturb, but we need to take care of the time schedule also.
Sure, sir. Going ahead with that. So through this, we are checking the evidence-based practice. Again, to assess the causality of a rare but serious ADR associated with the widely used medication, the following steps can be taken except. First is data collection, second signal collection, reporting to a PVPI center, and lastly literature review. So which of these will not be done to assess the causality?
Shivangi has answered correctly, ma'am. C.
That is, yeah. So this reporting to PVPI center will not help us to find the causality of the drug. Okay, so ADR evolution, how we are using the reasoning skills is what we are doing here. So that was all the questions that we have been using example. So that way you can frame your own questions for your own institute. In summary, today we have discussed that developing reasoning skills in pharmacology for the undergraduate as well as for the postgraduate students contributes to safe and effective medication management. Secondly, it helps in medical research and also decision making for the benefit of the patient. We also discussed that questions for assessing reasoning skills shall be based on real life scenarios. The question patterns can be open-ended or MCQ based, which can be scenario based or fact based or statement based. And the aspects to be assessed in relevance to pharmacology include drug interactions, dosing and treatment planning, adverse event evaluation for research, patient education, medication safety, and evidence-based practice. Not much has been given in literature, but I found some articles useful. So these are the references. That's the end of my session. I'm open for the questions now.
Thank you, ma'am. Thank you for the wonderful session. Very informative and very explanatory. And within the time given, it was very interactive session. And really, it has clinched the critical thinking skills in all the participants who was participated in the online learning series. It's a wonderful session, ma'am. The question for you, Dr. Shruti Singh has asked, are there any validated scales for testing reasoning skills?
This was what we were looking for. Till date, there is no validated scale or any rubrics framed. This is open actually for research. We can make our own. So as this document has come out now, so we are also working to make some rubrics and to make some framework. But till now, we have framed these questions. We're working on these, and soon we shall come out with some sort of rubrics, and we shall share with you.
Is there any other assessment method apart from MCQ for reasoning skill? Was asked by Monish Solanki, ma'am.
Not in my knowledge. That's what I could think of, because reasoning for pharmacology. So it's only, that's what we can go through questions. A for clinical reasoning, but then it's taking history and examination, that is not our aspect. So I think MCQ or asking questions, even open-ended questions, that I think that's the only way we can do in pharmacology.
That's all the questions for you, ma'am. Wonderful session, ma'am. Thank you to all the organizers for giving me this wonderful opportunity.
Thank you, ma'am.
Over to you, sir.
So nicely moderated.
Thank you, Dr. Parimala, madam, and Dr. Suyog Sindhu. It was really an excellent session, and we, due to the time constraint, it may not be possible to include all the things, but we have now opened the WhatsApp group, and that group is open to all the delegates. Delegates can ask the questions in the WhatsApp group also, and they can continue discussions in WhatsApp group later on. So I just want to say my sincere gratitude to all the participants for taking the participation in this series 4 online learning series workshop, competency-based medical education in pharmacology. We sincerely thankful to our President, Dr. Padamja Uday Kumar, and General Secretary Dr. R.K. Dixit sir for their guidance and leadership. And thank you to both the speakers, Dr. Sawanand Pathak and Dr. Suyog Sindhu, and both the learned moderator, Dr. Parveen Sharma and Dr. Parimala K, to take out time and for accepting our invitation to participate in this learning series. And with these words, I would like to conclude the today's session. I hope we will be meeting again next week on Thursday, 3 to 4 p.m. Due to the various technical reasons, the time have overshooted for today's session because it was the inaugural session also. We will take care of the time constraint from now on. So the session will start at exactly 3 p.m. and it will conclude at 4 p.m. With these words, I conclude today's session. Thank you for joining us, and thank you from the National Association of Pharmacology and Therapeutics. Thank you all.